Okay, so without wasting any time, let's start with the UPPSC 2019 paper discussion. So first we will talk about the general studies questions, and then we will start with the dental surgery questions, dental questions. So the first question we have is the famous milk producer in India, Amul, which is the milk brand, is what? It is a cooperative society. This means that it is owned by and it is operated by a group of people, group of individual, and mainly these are the dairy farmers. So who come together, they collectively manage the production, processing, as well as marketing of the milk and milk products. So this cooperative model allows the dairy farmers to have a better control over their livelihood and the dairy industry. Now this is the correct option, the cooperative society. The next option B is private limited company. Amul is not a privately owned company. It operates on a cooperative model, not as the privately held corporation. The C option is public limited company. Amul is not a publicly traded company with shares traders on the stock market. There is no such that. And option D is none of the above. That is correct because Amul is indeed a cooperative society. Now coming to the second question, Panchayati Raj was started in India when? So Panchayati Raj was started in India in 1959. So it was introduced as a system of local self-government at the village, intermediate and district levels. And it was in order to promote the rural development and decentralized governance. So the option which is correct is our option D, which is 1959. What about 1951? It was not initiated in 1951. In 1952 was also correct because Panchayati Raj did not begin in 1952, and again option C is also incorrect. Coming to the next question, which of the following districts are not included in the Varanasi Mandal? So the answer is Mirzapur. It is not included in the Varanasi Mandal system, as Varanasi, Chandauli and Jaunpur, these are the part of the Varanasi Mandal system. The greatest number that will divide 2930 and 3250 will leave us the remainders 7 and 11 respectively is. Okay, so let's break it down simpler. Imagine you have two big numbers, 2930 and 3250. You want to find the biggest number that can go into both of them, leaving behind a remainder of 7 and a remainder of 11 for 3250. 7 for 2930 and 11 for 3250. Now think of it this way. You have two big jar of marbles. One with the marbles having 2930 count. Another one with the marbles having 3250 count. Now you want to find out the largest bag that can hold the same number of marbles when you transfer them from both jars, and you are left with 7 marbles in this jar and you are left with 11 marbles in this jar. So to find the greatest number that can divide both 2930 and 3250 and leave behind the number 7 in this and number 11 in this. So you need to have a simpler method or simpler way, and that is finding out GCD, which is the greatest common divisor. GCD, which is the greatest common divisor of two numbers. It is the largest number that can divide them both. So the largest number that can divide 2930, that can also divide 3250. Now for this we need to find out such a number that after dividing we get 7 in this and 11 in this. So if you minus 7 from 2930, so 2930 minus 7 becomes 2923. And if you minus 11 from 3250, then it becomes 93 and 2 and 3. So 3239 and 2923. These are the two numbers that you get. So now you want to find the greatest common divisor between these two numbers, 2923 and 3239. So using the calculations for the greatest divisor that you get is divided them by 77, and you get 7 as a reminder for 2930 and 11 as a reminder for 3250. How many members are nominated for Rajya Sabha by President of India? The President of India nominates 12 members to the Rajya Sabha. So the answer is going to be C, which is 12. These numbers do not represent the correct number of members that are nominated by the President to the Rajya Sabha. Which of the following pairs is mismatched about the Pragyaraj Kumbha 2019? So it is asking about 2019, which of the following is mismatched, since this paper is 2019 paper. So for this 2023 paper, you should have the calendar for the 2023 exam. And since it is 19, so 19 paper, so they've asked about the same year. So read the same year. Which of the following is mismatched? The mismatched pair is Maghi Panchami. This is mismatched. So Maghi Panchami is mismatched. It is written on the 15th of February. It did not have on 15th of February. So coming to the next question, a woman has a certain number of mangoes, out of which 13% are bad. She gives 75% of the remainder in charity, and then she's left with 261. How many total mangoes she had at the beginning? So if we solve this question, initial mangoes, the woman starts with a certain number of mangoes. We don't know how many mangoes yet. 13% of them are bad mangoes, right? This means that out of her, she has 87% of the mangoes that are left. Then she gives 75% in the charity of the remainder 87%. So to find out how much she has left after the charity, we need to calculate 25% of 87%, because 100 minus 75 is 25. So that is remainder of the mangoes after the charity is 25% of the 87% of her initial mangoes that remain after the charity. So final count, she is left with 261 mangoes. This means that 25% of the 87% of her initial mangoes is equal to 261 mangoes. To find out how many mangoes she initially had, we have to set up an equation. Let's say x be the initial number. So 25% of the 87% of x is 261. We can solve this equation. 0.25 into 0.87 into x is equal to 261. Now divide both the sides by 0.25 into 0.87 to isolate the x. So x is equal to 261 divided by 0.25 into 0.87. So if you calculate this, that makes it 1,200 mangoes. So the woman initially had 1200 mangoes, and the answer to this questions become A, which is 1200 mangoes. Now coming to the next question, which of the following district of UP has the highest population? The answer is Pragyaraj, formerly that is known as Allahabad, has historically had one of the highest populations in the UP. So the answer is Pragyaraj. Which of the following pairs is not correctly matched? So vitamin A to carrot, vitamin E to palm oil, and which of the following pair is not correctly matched? It is saying not correctly matched. So the answer is B, that is vitamin E to palm oil. This is mismatched because vitamin A is primarily found in the vegetable oils such as wheat, germ oil or nuts. But palm oil is not significant source of the vitamin A. So that is why the answer is vitamin E to palm oil. The next question, K307, Satabdi is a variety of which? It is a variety of wheat. This means it is a specific type of strain of wheat that is used for the cultivation by farmers. So if you see option A, maize, it is not a variety of maize, it is not related to potatoes, and it is not a legume, which is a urad dal. Fundamental rights are contained in which part of the Indian Constitution? So they are contained in the part 3 of the Indian Constitution, and these rights are considered most fundamental because they ensure the protection of the individual, the person, liberty and the freedom. So part 4 deals with the directive principles of the state policy, not fundamental rights. Part 1 contains union and its territories, and part 2 covers the citizenship of India. Vande Mataram song was written by Bankim Chandra Chatterjee. It is a patriotic song. Vande Mataram, you must have heard this song, and that plays a significant role in the Indian independence movement. Muhammad Iqbal is known for writing लब पे आती है दुआ बन के तमन्ना मेरी. This song is written by Muhammad Iqbal. Then Sharat Chandra Chatterjee was famous Bengali novelist and a short story writer, but not the author. And Rabindranath Tagore, as we all know, wrote Indian national anthem, that is Jan Gan Man, not Vande Mataram. So the answer to this question is Bankim Chandra Chatterjee, who wrote the song Vande Mataram. Which of the following crops provide both oil and fiber? So it's alsi, the linseeds. Linseed provides both oil as well as fiber. Linseed oil is extracted from the flaxseed, which was trending during the COVID times. Everybody was buying flax seeds. These are also known as linseeds, and the leftover seed hunks can be used for the fiber production. So it is used both in oil and the fiber. Sun hemp provides fiber but not oil. Mustard provides oil but not fiber. And jute provides fiber but not oil. So providing both oil and fiber, it is alsi. Industrial licensing policy in India was abolished in the year 1991 as a part of economic liberalization reforms. So the answer is 1991. Which of the following belongs to the group Grand Planets and is the second largest in size? So Saturn belongs to the group of planets that are known as gas giants. Gas giants, some people say giant, gas giants or giants, or grand planets. It is the second largest planet among all the planets in the solar system, and the first largest being the Jupiter. Mars is not a gas giant or giant. It is often referred as the terrestrial planet because it has a solid surface. Venus is also a terrestrial planet because it has a solid surface and is not one of the gas giants. Mercury is the smallest planet in the solar system and is not a gas giant. Coming to the next question, Mozambique current flows, ocean current flows. Mozambique current is a warm water surface current. It is present in the Indian Ocean, and it flows the south along the African east coast in the Mozambique channels between the Mozambique and the island of Madagascar. So if this is South Africa, then we have this current flowing along the African east coast in the Mozambique channel and between the Mozambique and the island of Madagascar. Which of the following is the largest country in terms of area? So Canada is the largest country in terms of the land area, and Germany is not the largest country by land area. It is a European country which is relatively smaller area. Then South Africa is a country in Africa, but it is not the largest by land. Argentina is a large country in the South America, and it is not as extensive as the Canada in terms of the land area. The surface area of Canada is 9,985 million kilometers square. And the surface area of India, if you see, it is 3 millions. So 9 million is Canada and 3 million kilometer square is for India. So you can see Canada is the largest country if you see in terms of the land. The next question is Deccan Educational Society. This society, now the voice is clear. So next question is Deccan Educational Society. This society is an organization that runs 43 educational establishments in Maharashtra, and the branch being in Pune. So who founded this society? So this Deccan Education Society is the first English school which was in 18, so this school was established in 1884. This was the English school, and it was providing the higher education. So this Deccan Education Society was founded by Bal Gangadhar Tilak and Mahadev Govind Rande. So these Bal Gangadhar Tilak and both, so again both are present in the options, so we can tick mark the option Mahadev Govind Rande. Gopal Krishna Gokhale, he was a prominent Indian teacher and was a social reformer, but not the founder of Deccan Educational Society. And Bal Gangadhar Tilak, again prominent figure in the history. And Dadabhai Naoroji was a notable figure in the Indian National Congress and the politics, but he was not associated with the Deccan Educational Society. What was the number of princely states in India at the time of partition? So at the time of partition in 1947, there were 562 princely states. And these states are also known as the native states. They existed in India and were not fully and formally the part of British India. And after independence, they were given a choice either to join India or to join Pakistan. So there were 3 princely states that refused to join India, and these were Kashmir, Mysore and Hyderabad. So by 15th August 1947, all states except Kashmir, Mysore and Hyderabad agreed to join the Indian Union, and these 3 states were later merged in India with the constant effort of Sardar Patel's determination. Who gave the slogan "Swaraj is my birthright and I shall have it"? Bal Gangadhar Tilak in 1917, who had spent 6 times in prison and gave this speech in the Nasik in the ongoing public battle for self-government and eventually the full independence, in the expression "Swaraj is my birthright and I shall have it." Also, Bal Gangadhar Tilak was known as the father of Indian unrest by the British for his successful efforts in mobilizing the masses towards the freedom. He joined the Indian National Congress in 1890 and became a part of freedom struggle. His freedom was, his aim was to unite the people against the Britishers, and he was soon conferred the title of Lokmanya. Lok means word and Manya means acceptance. So he was accepted by all the sections of society as a leader, and along with the Bipin Chandra Pal, and the Lala Lajpat Rai, along with both of them, this Lala Lajpat Rai, both of them, along with the Bal Gangadhar Tilak, they became a trio in the freedom fighting, and this trio was known as Bal Pal Lal. So Bal Pal Lal, the trio was Bipin Chandra Pal, Lala Lajpat Rai and Bal Gangadhar Tilak. The next question, GDP growth rate in India during 2014-15 was GDP's gross domestic product, the annual average rate of change of gross domestic product at the market prices based on a constant local currency for a given nation economy during a specific period of time is this GDP growth rate. That means the rate of growth of this GDP, which is domestic growth product. What do you mean by that in the normal sense? So it is the final value of goods and services that are produced within a geographic location or geographic boundary of a country during a specific amount of time. Normally we take 1 year of time. So it is the final value of the goods and services that is within a country and during around an year of time, that is a specific amount of time. So what's the GDP growth rate in India during the financial year 2014-15? Excuse me guys. So it was approximately 7.3% for the year financial year 2014-2015. And the current growth rate of India is 8.7%. ICC has given 2 of its 2018 awards, that is Women Cricketer of the Year and Women ODI Player of the Year. Both of these awards were given to a single person, and who was that person? Was it Sophie, Elisa, Harmanpreet, or Smriti? It is Smriti Mandhana. Smriti Mandhana was the one who got both the ICC awards of the Women Cricketer Award of the Year and also Women's ODI Player of the Year. So in 2018, she got both of these awards. Sophie is a talented cricketer, and but she did not receive these ICC awards. Alyssa Haley is also Australian cricketer, but she did not receive these awards. Harmanpreet Kaur is an Indian cricketer and captain, but she did not receive both of these awards in 2018. Who was the chief guest at Indians Republic Day Parade? On 26th January 2019, again this question was this paper was in 2019. So remember the current year, you have to see the current year things. So they have asked about the chief guest in 2019, 26th January. The answer is the chief guest at Indian Republic Day Parade on 26 January 2019 was the President Cyril, that is of South Africa. The President Cyril Ramaphosa, who is the President of South Africa. So coming to option A, the Prime Minister P. Jagannath. This was not the chief guest at 2019 Republic Day Parade. Option C, that is the President Robert, was not the chief guest. And D, the Prime Minister Lars Lokhe. He was also not the chief guest. Now in the film Manikarna, who played the role of Rani Lakshmibai? We know who played the role of Rani Lakshmibai, that is Kangana Ranaut. So the answer to this question is Kangana Ranaut. She played the role of Rani Lakshmibai in Manikarna movie. Vidya Balan, talented actress, but did not play this role. Taapsee Pannu, again accomplished actress, but she did not cast as Rani Lakshmibai. Rani Mukherjee, again well-known actress, but she did not play the specific character in the role. Which of the following varieties, mango varieties, is preferred most for export? So Alfonso mango variety is preferred most for export. It is known for its exceptional taste, aroma and the quality, and making it highly sought after in the international markets. Now Alfonso, if you have seen Mazda ads or some ads, they have shown some very nice pictures, big mangoes. You can cut it and eat it with a spoon also. So all these mangoes that we eat, these are the Alfonso mangoes. While Langda is the most popular variety in India, but it is not commonly exported. Chausa, again very delicious mango, but Alfonso mangoes are typically more popular for exports. And Fazali mangoes are not well known for export as well. What is the new name of train 18? So the new name of train 18 is Vande Bharat Express. It is semi-high speed train in India, and it is well known for its modern amenities and its features. So this is the answer to this question is the Vande Bharat Express. Which of the following biomolecule is a protein? It is keratin. Keratin is a protein. So keratin is a protein. It is a structural protein that is found in epidermis, nails, hair, and the feather of animal. Glycogen is a carbohydrate. It is not a protein. Then chitin is a complex carbohydrate, again not a protein. And then we have cholesterol. See, chitin is a complex carbohydrate that is found in the cell walls of the fungi and the exoskeleton of some animals, but it is not a protein. And cholesterol is a lipid molecule. It is not a protein. Which of the following is located between the Andaman and Nicobar Island? Actually, channel 10 degree is the channel that is located between the Andaman Island and the Nicobar Island, is in the Bay of the Bengal. So it is 10 degree channel that is located between the Andaman and the Nicobar. Great channel is not located. Again, 8 degree channel is not located, and 9 degree channel is not the correct location. The Rowlatt Act was passed in 1919 AD. It was officially known as, it's an anarchical and revolutionary crime act that was popular in 1990, and it was a law applied during the British India period. So it was passed, this Rowlatt Act was passed in 1919, passed by the British government to increase their grip on the power over the common Indians. So this was the law. The British government passed this act to give power to the police to arrest any person without any reason. And this was how Britishers were during that time. And Mahatma Gandhi called upon the people to perform the satyagrah against this Rowlatt Act. and the name was given by a Britisher after its president, Sir Sidney Rowlett, and this was kind of a terrorism by the Britishers to Indians, and it was up to 2 years. Now coming to the dental questions, which of the following is least likely to be associated with the increased risk of oral cancer? So the options are arthroplakia, leukoplakia, leukoedema, and OSMF. So this is again an image from our crash course notes and the crash course lecture. So you can see the precancerous lesion and condition. Leukoplakia is there, arthroplakia is there, and OSMF is there. What is not there is leukoedema. So it has asked as least likely, that means which is not associated or least associated with the increased chances of having oral cancer. Leukoedema is the least likely to associated with the increased risk of oral cancer. It is a benign condition which is characterized by whitish opaque appearance on the oral mucosa inside, involving the cheeks, specifically in the cheeks. While on the other hand, all rest are having high risk of chances of having oral cancer. So what are the precancerous lesion? Leukoplakia, arthroplakia, palatal keratosis with the reverse smoking, and the conditions are sideropenic dysphagia, lichen planus, OSMF, syphilis, discoid lupus erythematosus, and xeroderma pigmentosum, epidermolysis bullosa. So leukoplakia more common, and there are white patch or plaque that cannot be rubbed off. So this is how a leukoplakia looks like. The risk factors are smoking, alcohol, ill-fitting dentures, and jagged tooth. Pathological features, hyperkeratosis and parakeratosis is seen, as well as acanthosis is seen. Arthroplakia having more chances of risk of having oral cancer. So this arthroplakia, and more than arthroplakia is arthroleukoplakia, the combination of both. So this is the high risk of malignant transformation, arthroplakia, and arthroleukoplakia is the highest risk of having malignancy, which is arthroleukoplakia, which is also known as speckled arthroplakia or speckled leukoplakia. So all these things we have already covered in our OSMF. Again, OSMF is one of the options. It is a pre-malignant lesion wherein a fibrous band is formed that restrict the mouth opening, and that also increases the risk of squamous cell carcinoma, and these are seen in the individual having betel nut chewing or areca nut chewing. So all these things are associated. So these are the explanation from our notes from the crash course lecture. Infections in the dangerous area of the face usually led to, so infection in the dangerous area of face leads to what? This is the danger area of the face. Again, this is from one of the notes from lecture, from the crash course lecture of anatomy. So what is the dangerous area of the face? It starts from the medial canthus of the eyes and to the upper lip. This is a triangular. This is the danger area of the face. Any small infection in the nasal pustule can spread the infection via facial vein, and it can go to the angular vein and goes to the superior ophthalmic vein. It can go to and reach the cavernous sinus, and it can cause cavernous sinus thrombosis. What are the structures that pass through cavernous sinus? From the lateral wall of the cavernous sinus, third, fourth, fifth one, V1 and V2 are the one that pass from the lateral wall, and from inside the cavernous sinus is the sixth cranial wall and internal carotid artery. So the structures that pass from the lateral wall of the cavernous sinus are 3, 4, V1 and V2, and the one that passes from inside the cavernous sinus is internal carotid artery and the abducens nerve. EVA system is used for the following purposes. EVA system is used for correcting the overhanging margins of the restoration. It helps in achieving the precise and accurate restorations by removing any excess material. Ultrasonic scaling is a different dental procedure that is used to remove the plaque and the calculus from the teeth. Then gingival curettage is a procedure for cleaning the gingival pockets, and root biomodifications is a procedure for is the surgical procedure that is aimed at the altering the structure of the roots for the periodontal reasons. What is the minimum requirement of the fluoride for a 6-year-old baby living in the area where the fluoride in the water is less than 0.3 ppm? So we have a table from our crash course notes. From the crash course lecture, we have already discussed this table. This is when the age of the child is between birth to 6 months, 6 months to 3 years. So this is our table from the periodontics lecture, 3 years to 6 years, 6 year to 16 year. This is the fluoride that is in particular area. If the fluoride is less than 0.3 ppm in the drinking water, community water, then from birth to 6 months, we need not to give anything to the child. We need not to give any dietary fluoride. If the area having drinking water of fluoride that is less than 0.3 ppm, if the child is 6 months to 3 years, then we can give a dietary supplement of 0.25 milligram. If the child is 3 to 6 years and if the fluoride is less than 0.3 ppm, then we need to give 0.5 mg. Now see, if the area contains fluoride of 0.3 to 0.6 ppm, then for 6 months to 3 years child, we need not to give any fluoride supplement. For birth to 6 months, so we need not to give any fluoride supplement. And for 3 years to 6 years, if you increase the fluoride content, you can decrease the dietary supplement of the fluoride. So you have done it to half. That is, if it is from 0.3 to 0.6 ppm in the area, then you can give dietary supplement of 0.25 mg of fluoride. And for 6 years to 16 years, if in the area the fluoride is less than 0.3 ppm, you can give 1 milligram of dietary fluoride. If in the area fluoride is 0.3 to 0.6 ppm, you can give 0.5 milligram of the fluoride. And if it is more than 0.6 ppm, you actually need not to give any fluoride. So they normally ask question from either of this. They normally ask question from either they will ask you from if the area has got greater than 0.6 ppm, or they can ask you if the age of the child is 3 to 6 months. In both of these categories, there is no recommended fluoride that you need to give. Because for a 6-month-old baby that is living in the area where fluoride is less than 0.3 ppm, the minimum fluoride requirement is 0 mg, and the infant under 6 months of age do not typically require the fluoride supplement, as they are relying on the breast milk or the formula nutrition, so they do not need. Now the next question, in systemic LA toxicity, there is a typically a phase of convulsions, and this phase is followed by a phase of depression. So this sequence of event is known as post-convulsion depression. Now post-depression convulsion, which is option A, is not typically pattern that is seen in systemic LA toxicity. It is the post-convulsion depression that is seen as the LA toxicity, the systemic LA toxicity. Convulsions are a part of systemic LA, but they are not followed by the depression, and depression is in the context refers to post-convulsion phase and not the initial. So Tinel sign is meant for, Tinel sign is used in medical examination to assess the nerve regeneration. It involves tapping or slightly pressing the nerve on a specific area of a nerve pathway. So we observe for any tingling or sensory response, and if there is a response by tapping the nerve, if the patient tells that patient can feel that, this means there is a regeneration happens for the nerve. So this sign is a sign for nerve regeneration, and this sign we have also covered in our crash course lectures. So in the crash course lecture, you can see in oral pathology and medicine, we have discussed Tinel sign, start of nerve regeneration. Also there is Verrill sign, that is for partial ptosis of the eye, partial ptosis, blurring of the vision, and slurring of the speech. Tinel sign is not related to ear problem. It is nerve degeneration. While Tinel sign can provide some information about the nerve health, but it tells about the nerve regeneration, not the degeneration. Arterial partial pressure of oxygen is normal, but the amount of hemoglobin available to carry the oxygen is reduced. What happens in anemia? The amount of hemoglobin available to carry oxygen is reduced. Hemoglobin is reduced. If you have seen a CBC sample, in that, if hemoglobin count is reduced, we call the person is having anemia. Even if the partial pressure of the oxygen is normal, in that case, if you put a SpO2 monitor in anemia patient and observe the partial pressure of oxygen, it is above 97 only, it is normal, but the hemoglobin in those individuals are reduced. So it is anemia, which is a condition that is characterized by decrease in the number of RBCs or decrease in the amount of hemoglobin that can lead to reduced oxygen capacity. But how much ever hemoglobin is present, it is carrying normal oxygen. So carbon monoxide poisoning, answer to this option is anemia. Carbon monoxide poisoning affects the binding of the oxygen to hemoglobin, but not necessarily reduce the amount of hemoglobin that is available. Right to left shunt can result in decrease arterial hemoglobin level. So it can cause conditions such as hypoxemia but do not directly affect the amount of hemoglobin. Hypovolemia refers to decrease in the blood volume but does not directly affect the amount of hemoglobin that is carrying the oxygen. The next question, lidocaine produces its anti-arrhythmic effect by. How lidocaine act? We have discussed this in our oral surgery crash course series, that most accepted theory is the specific receptor theory, and how this LA act is by decreasing the depolarization, by increasing the threshold potential, and by increasing the time of repolarization. So if you decrease the depolarization, then the time of repolarization will be prolonged. So prolonging the rate of repolarization. So lidocaine produces its anti-arrhythmic effect by decreasing the cardiac excitability. It will not let heart excite. It acts by inhibiting the sodium channels in the heart and reducing the influx of the sodium ions in the cardiac cells. It will reduce that. It will not let sodium go inside the cardiac cells, and therefore it decreases the excitability of these cells, and this helps in controlling the certain type of abnormal heart rhythms. So the answer to this question is B, that is decreasing the cardiac excitability. Looking at the option A, that is increasing the AV conduction, lidocaine does not increase AV conduction, it tends to stabilize it though. Option C, increasing the spontaneous pacemaker activity. Lidocaine typically reduces the pacemaker activity. And option D, increasing in the cardiac conduction velocity. Lidocaine have some effects on the conduction velocity, but it's not the primary action on excitability reduction. So the answer to this question is decrease in the cardiac excitability. Next question, the armored or flexometallic tubes are used in, they are used in head and neck surgeries which require the manipulation of the neck. These tubes have flexible metallic spiral within the tube, and it prevents the kinking, and it also provides the stability during the procedure. Now the next question is Fordyce's spot. Fordyce's spots are what? They are the spots that are present in the cheek. So if you see the cheek mucosa that is lateral to the angle of the mouth, if this is the angle of the mouth, you go lateral, they are seen as the white spots, yellowish white spots, some raised spots that are present in the cheek, and they are the normal variation. They are small, raised, yellow, white or pale spots. So these Fordyce's spots, again we have covered in oral pathology and medicine. This is a slide from the crash course series. So you can see these Fordyce's spots, and they are present opposite to the first molar on the both sides in the buccal mucosa. You will see how we have remembered it. Dice, in the dice we want always 6 numbers, so 6 is opposite to the 6, that is first molar, is what we see these spots. So Fordyce's spots, they are the mostly seen at the cheek and lateral to the angle of the mouth. Neutral zone concept, it was given by Wilfred Fish. That is a concept in dentistry. It is important concept in prosto, and it refers to the ideal placement of the dental prosthesis. So what is neutral zone? Now we have teeth over here. This teeth, there are forces that are coming from the cheek towards the teeth. We have tongue. There are forces from the tongue that are going towards the teeth. So if these are the placement of the teeth, then we have forces that are coming from cheek from one side, forces that are coming from tongue from the other side. When we are placing the teeth, when you are giving denture teeth in a denture, you do not want denture to be displaced or RPD. So you want to place the teeth in this neutral zone where the forces of the cheek are equal to the forces of the tongue. So teeth are in the place, denture are in the place. So this is a concept that we make in the prosto, in which we arrange the teeth. Now most toxic form of the mercury, is the methyl mercury. So methyl mercury is the organic compound that can accumulate in a food chain, and it is well known for its severe neurotoxicity, toxic effects. Elemental mercury is the less toxic mercury, and it is typically found in the liquid form at the room temperature. Mercury vapor are seen when you are removing any amalgam restoration with the help of a aerator. So these are the vapors that can be inhaled even if you are wearing a mouth mask. And ionic form of the mercury, it's toxic and but less toxic than the methyl mercury. So again, this is a slide from the crash course of the dental materials, and you can see the mercury toxicity is the safe level. Again, one of the question in this exam only is from the safe level of the mercury toxicity. What is the safe level? We will be studying this question, and in this 2019 paper there is a question that what is the safe level. Safe level is 50 micrograms of mercury per meter cube of air. Primary risk is the inhalation of the mercury vapors while either you are removing the amalgam restoration or you are polishing it. Mask cannot filter the mercury vapor. Half of the mercury, half-life of the mercury is 55 days, and it transports before it stays in the body till 55 days. Mercury toxicity in the children is known as pink disease, which is also known as acrodynia. Why pink disease? Because the skin turns into pink color. Also, there is increase in the salivation, ulceration of the mucosa, and the teeth start shedding. There is premature shedding of the teeth that is seen with the mercury toxicity in children. What is the main cause of having this mercury toxicity in children? It is either the teething powder that contains mercury or the ammoniated mercury ointment or any calomel lotion which is having mercury. So we have discussed this in the crash course lecture also. There are three forms of mercury. The methyl mercury, which is the organic form, most toxic form found in seafood or fish. Elemental mercury, which is because of the dental procedures. These are the mercury vapor, and inorganic mercury. Next question, the longest duration, the long duration anesthesia is achieved by, long duration anesthesia can be achieved by 0.5% bupivacaine with epinephrine 1:2 lakh. Bupivacaine, it is bupivacaine, it's here, bupivacaine HCl. Bupivacaine is known for its extended property, that is extended duration of actions, making it suitable for prolonged pain relief in various procedure. Bupivacaine is a long-term local anesthetic. So when it is combined with epinephrine, then we can use it for the longest duration for anesthesia purpose. Which of the following is not a cause of atrial fibrillation? Now, atrial fibrillation, it is an irregular heartbeat and a rapid heartbeat, you can say. So atrial fibrillation, if you see, we have again covered. Okay, bupivacaine, you can see the half-life of the bupivacaine. It is longest half-life. So that is why it stays for a longer period of time. That is why we can use it for long procedures. This is again from a class of crash course, a video from a crash course lecture. So which of the following is not a cause of atrial fibrillation? Then we have, this is the atrial fibrillation. Now normally the heart rhythm is like this. You can see the interval is very regular. And in case of atrial fibrillation, which is irregular heartbeat, you can see the irregularities. Somewhere it is more, somewhere it is very less. So it is irregular heartbeat, which is known as the atrial fibrillation. So atrial fibrillation, which of the following is not a cause? It is asking not a cause. That means hypothyroidism can be a cause. Diabetes cannot be a cause. Typically, it is considered as a direct cause. It is not considered as a direct cause. Atrial fibrillation is often associated with the other risk factor like hypertension, heart disease, hyperthyroidism, in fact. But diabetes is not a primary cause. So atrial fibrillation, the answer to this question is diabetes. The cranial nerve involved in Ramsay-Hunt syndrome. The main nerve that is involved in the Ramsay-Hunt syndrome is the facial nerve, which is the fifth cranial nerve. Seventh cranial nerve. Fifth cranial nerve is the trigeminal. So it is seventh cranial nerve, V7, which is involved in the Ramsay-Hunt syndrome, and it is a viral infection, and it affects the facial nerve, often lead to facial weakness or paralysis along with a painful rash in the ear and the mouth area. So it involves the facial nerve. Now, okay, we have covered this in the oral pathology and oral medicine crash course lecture. Ramsay-Hunt syndrome is the herpes zoster of the geniculate ganglion, involvement of the external ear and the oral mucosa. Apart from that, in the slide, we also have Ritter syndrome. It is a triad of urethritis, arthritis, conjunctivitis, and oral ulcer. Precursor of testosterone, the prednisolone. So pregnenolone is a precursor to the testosterone. Pregnenolone is a steroid hormone, and it serves as intermediate in the biosynthesis of various steroid hormone, and that includes testosterone as well. So methyl testosterone is a synthetic derivative of the testosterone. It is not a precursor. And estrogen again is a separate class of sex hormones, and it is not a direct precursor to testosterone. So it is pregnenolone. Mutations are due to changes in mutations are typically due to changes in the DNA nucleotide sequence, and mutation occur through various processes. It can be either substitution or addition, deletion, rearrangement. So these changes can lead to a genetic variation, and that is known as the mutation. So RNA nucleotide sequence, if you see, while RNA can also undergo mutation, DNA mutations are more common and often have more significant impact on the genetics of the organism. RNA nucleotide sequence is just, we have talked about just now, we talked about RNA, not DNA, we talked about RNA nucleotide sequence. So, excuse me, just because a long session. So RNA nucleotide sequence is mutation in the RNA, and mutation that is due to changes in the DNA nucleotide sequence. Then amino acid sequence of ribonucleases, these are the mutation, and ribonuclease may occur, but not primary focus of the genetic mutation, and cell walls are not directly related to the genetic mutations. So mutations, point mutation is a replacement of one base pair by another. This is a slide from the biochemistry subject of our crash course series. And then we have point mutation is at a point, one base pair by other, and frame shift mutation is insertion, deletion of one or more base pair. It can be either silent mutation, missense mutation, and nonsense mutation. Decalcified freeze-dried bone graft is an example of. So a decalcified freeze-dried bone graft, it is an example of allograft. Allograft is a tissue or the organ transplantation from one individual to another individual of the same species with a different genetic makeup. This means a decalcified freeze-dried bone graft are sourced from human donors and they are processed for transplantation to another person. So options: xenograft involve transplantation between the different species, not within the same species. Autograft involve using an individual's own tissue. That means if I want some graft, so taken it from my body only, that is an autograft. Allograft is our answer to this question, that is decalcified freeze-dried bone graft is allograft. And plast word means, you can see these are plastic, that means they are artificial or synthetic material that are used in grafting procedures, and they are not the derivatives of human donors. So you can see this is a slide from the perio subject of our crash course, and in the bone graft we have already discussed, from same individual is autograft, identical is iso, same species is allograft, and decalcified freeze-dried bone graft is an example of allograft. Also freeze-dried bone graft is an example of allograft as well. Different species we have xenograft. So in the different species we have bovine derived bio-os, calf bone, that is bioplant, or keel bone. Apart from that, autograft is the one taken from the own body, and that is it can be taken from intraoral site like osseous coagulum, bone blend, cancellous bone marrow transplants, or bone swagging, or also it can be taken from outside the oral cavity, that is from the body, iliac crest, fibula, tibia, and the ribs. So synthetic graft, which is alloplast, right? Plast word means that it is plastic or it is synthetic graft. The ratio of hydroxyapatite. In the hydroxyapatite, the ratio of calcium to phosphate, very important for exam point of view. The ratio in the hydroxyapatite calcium to phosphate, it is 1.67. So calcium to phosphate is 1.67, and this is in normal hydroxyapatite, the normal bone. While in case of tricalcium phosphate, the calcium to phosphate ratio is 1.5. So this is again asked in the exam. This is bioactive glass and certain time asked. So freeze-dried bone graft. Freeze-dried bone graft is osteoconductive. It conducts the bone synthesis. While decalcified freeze-dried bone graft is osteoinductive. It induces also bone synthesis. Now coming to how much roots resection is done during a periradicular surgery. It is 3 mm of the root resection is performed. This procedure involves the removal of a portion of the root to treat the conditions which having persistent infection or cyst or any pathology that is related to the tip. So we cut 3 mm. This also we have covered in our perio lecture series. So the next question is, one canal leaving the chamber and dividing into two separate and distinct canal. So one canal, if this is one canal that is leaving the chamber, so from chamber it is one canal and it is dividing into two. So this is the classification that we need to classify. This also, guys, this is from the endodontics of our crash course lecture. So classification of the canal anatomy, what you see classification, but here they have asked about the veins classification. So canal exiting as one and dividing into two. So this is the classification, that is class 3, exiting as 2. And the answer to this question is type 3. Popcorn cells. These popcorn cells are seen in. So you can see popcorn cells are the characteristic feature of Hodgkin lymphoma. They are the cells that are large, multinucleated with a distinctive appearance under the microscope. So the Reed-Sternberg cell, lacunar cells and popcorn cells, these all are cells seen in the Hodgkin lymphoma. And nodular sclerosing lymphocyte predominant type, these are the types of Hodgkin lymphoma, and in these types we see the popcorn cells. So popcorn cells are seen in Hodgkin lymphoma. Now coming to the next question, bristle size of adult toothbrush is, this also we have covered in the perio crash course lecture. So you can see these are the ADA specification numbers. Now we don't have time to discuss all this. So if you come to the point, in the soft bristle to hard bristle, this is the adult toothbrush, 0.007 to 0.014 inch. So the answer to this question is going to be 0.007 to 0.015 inch. This is the bristle size of the adult toothbrush from soft to medium to the hard brush. Coming to the next question, which instrument is used to cut the tooth in a lingual split technique? A chisel is often used to create a cut, and it creates a controlled split in the lingual aspect of the mandible, and this technique is used in third molar removal, extraction of the third molar. So this is, again, we have discussed in the surgery. Chisel is something that is used to remove the bone. Osteotomes are typically used to manipulate the bone, not for cutting the bone. So answer is the chisel, which is used to cut the tooth. And straight elevators are the elevator that is used for tooth extraction, but not designing for cutting. Again, surgical burrs are for cutting the bone or the tooth structure, but they are not specific to the lingual split technique. So what they have asked in the question is the lingual split technique. Answer to this question is chisel. Side effect of which of the following antitubercular drug are hepatitis except? So when the antitubercular drugs we talked about, there are certain side effects. Hepatitis is not typically associated with ethambutol. However, it is a side effect of the antitubercular medicine. So the answer to this question is ethambutol. Because when we talk about hepatitis, then we see that either it is related to liver. So if it is hepatotoxic, that we need to see when we are studying about the antitubercular drug. The next question, which of the following material is used to cover calcium hydroxide liner? If this is a calcium hydroxide liner, which of the following material is used to cover that under amalgam restoration to prevent the dissolution of the liner? We know that calcium hydroxide dissolves very easily. So what is the cement that you use? It is resin modified glass ionomer cement that is used to cover a calcium hydroxide liner under the amalgam restoration, because this resin modified GIC cement provides a seal and it prevents the dissolution of the calcium hydroxide liner. Corn-cob appearance. Corn-cob appearance is seen in, now this appearance, this is again a slide from our crash course. We have studied about two kind of appearances. One is this test tube brush appearance, another one is corn-cob appearance. Corn-cob appearance, there is actinomyces or Bacteremia matrichoti. So these bacteria, they are present in the long rod form, and with this rod there are certain cocci that are present, such as cocci of streptococci or P. gingivalis, and they form a structure that appears like a corn. If you have seen a corn, there is a stick, and on that stick there are small corns. So this is an appearance that is seen in gingivitis. While on the other hand, test tube appearance, wherein there is a long filamentous bacteria and there are rods, gram-negative rods that are present along with it, and this is seen in subgingival plaque that is associated with periodontitis. So test tube appearance is seen in periodontitis, while on the other hand, corn-cob appearance is seen in gingivitis. So corn-cob appearance, the question is corn-cob appearance is seen in, it is seen in supragingival plaque, So it is supragingival plaque is the bacteria that forms the biofilm that is visible on the surface, and it can accumulate and give texture that resembles the concave appearance. So coming to the next question, thickness of extra heavy rubber dam. Thickness of the rubber dam we have discussed in the image based question of conservative endodontist of our crash course series. So rubber dam sheets, there are various thicknesses. You can see they have asked about extra heavy thickness. So from thin to extra to special heavy, we have every 0.05 mm addition. Every step we have 0.05 mm addition. So add 0.05 to 0.15, that makes it medium rubber dam thickness is 0.20, add 0.05 to it, that makes it 0.25, 0.30 and 0.35. So 0.15 millimeter, that is the rubber dam thickness of a thin rubber dam sheet, and 0.35 millimeter is the rubber dam thickness of extra heavy. They have asked a special heavy, they have asked about extra heavy. So extra heavy is 0.30 millimeters. That is the D. Option D is the answer. The thickness of extra heavy rubber dam is 0.30 millimeters. The structures that do not travel through the parotid gland is. So the structures that pass through the parotid gland, this is again a slide from the crash course of our anatomy. So structures passing the parotid gland is retromandibular vein, external carotid artery, and sympathetic plexus that is around the external carotid artery, and the facial nerve pass through it but do not supply, pass through it and give off 5 branches. So the structures that do not travel through the parotid gland, it is the internal carotid artery that do not travel through the parotid gland. Superficial temporal artery is a branch of external carotid artery. As I told you, external carotid artery travels through it. So it is a branch of the external carotid artery and supplies blood to the scalp and the face. Posterior auricular artery is also a branch of external carotid artery, and it supplies blood to the ear and the surrounding area. External carotid artery, as I already told you, external carotid artery is the structure that pass through the parotid gland. So the answer to this question become internal carotid artery. Sign and symptom of a commonly suggested cardiac failure in a patient being assessed for oral surgery. So ankle edema, that is the swelling of the ankles, and dyspnea, that is shortness of the breath. These are the common signs and symptoms that are associated with the cardiac failure. Cardiac failure can lead to fluid when there is a cardiac failure, that means the heart is not able to push blood into the systemic circulation. There is a failure in this process. Now what happens? This can lead to fluid retention in the body, and this fluid retention can cause swelling in the extremities, especially in the ankles, and there you can see pitting, that kind of edema also that is seen, and there is difficulty in the breathing also. Especially the puffy leg swelling, that is edema, it is a sign of the right heart failure. So it is pitting edema. If you try to press it, it stays at its position. So answer to this question is ankle edema and dyspnea. Elevated temperature and nausea. Elevated temperature and nausea are not typically specific to the cardiac failure. Palpitation and malaise can be associated with various conditions that are related to the heart, but they are not specifically indicator to a heart failure or cardiac failure. Then erythema and pain. Erythema is the redness of the skin, and pain are not typically sign of the cardiac failure. In CPR, sternum should be depressed at what rate? So this is again a slide from the oral surgery, and in general surgery also we have studied the same thing from the crash course lecture. It is the cardiopulmonary resuscitation, and I have seen an image, a reel in which the patient is lying on the chair and the person is giving a CPR on a chair. So the first thing that you do is make sure the patient is lying on a flat surface, and then see if the patient is conscious or not. You tap the patient's shoulder and then check, and then call for help. Don't be a hero by yourself. Call help, check pulse, and check carotid pulse. Again, carotid pulse, we have made a reel on the Instagram, and as well as we have made a short on the YouTube channel. So how to check carotid pulse? How do we check carotid pulse? You can check the carotid pulse and check for the breathing of the individual, and then give the CPR. How should you give CPR? You give chest compression at the rate of 100 to 120 minutes. Then place hands at the lower 1/3 of the sternum. Sternum is the chest bone. Place hands at the lower 1/3 and then give the forceful compression. There should be pressure on the chest bone, xiphi sternum. And if the pressure is more, then it can also lead to liver damage. So how much pressure should you give? How much depression should be there? That is 5 centimeter. 1.5 to 2 inches of depression should be there. What is the compression force? And the question that is asked is the most common solid organ that is traumatized in CPR. It is liver. Very important, most common organ that is traumatized in the CPR, it is liver. Hip joint act as the fulcrum, and if you fracture the ribs during giving CPR, also you still continue to give the CPR. So ratio of CPR, it is compression is to ventilation ratio. In adult, it is 30 compression, 30 times you compress the chest, and 2 times you give the breathing, mouth to mouth, or you either whatever the breathing, however you are giving the ventilation, or 2 times you are giving the breathing. For child or for adult, you can use either 1 or 2 rescuer. For child, it is 30:2, 30 times compression, 2 times ventilation. In the child, if the rescuer is 1, we give 30:2, but if the rescuer are 2, then we give 15:2. 15 times chest compression, 2 times breathing. And the neonate, you have to make sure that there are 2 rescuers for neonate. So in CPR, it is recommended to perform the chest compression at the rate of approximately 2 inches, about 5 centimeters deep, at a rate of 100 to 120 chest compressions per minute. So 1 inch per second, this rate is, this 1 inch per second, the chest compression should be deeper than that, and at a faster rate in CPR. Then the option C is 1 inch per 5 seconds. This rate is too slow for CPR. Or 2 inches per 5 seconds. Again, this rate is slow. An empty cavity in the mandible with no lining. With no lining means there is no true cyst. What is the definition of the cyst? There should be a lining, epithelial lining that lined the cyst. No lining means we are talking about the pseudocyst here, which is most likely. What is the answer? It is idiopathic bone cyst. This is not actually cyst. So we have also discussed all these points in our oral pathology and medicine crash course series, that Stephanie's or static bone cyst is the cyst that is present below the mandibular canal. It is a developmental lingual mandibular salivary gland depression. While on the other hand, traumatic or hemorrhagic bone cyst or idiopathic bone cyst, it is present above the mandibular canal. So guys, that's about the 1 hour of our live class. And the thing about this live class is that we do the previous year paper, we know how to solve them, and we get an idea of what kind of questions that are going to be asked in this UPPSC exam. And you can correlate with the things like they have asked question related to the current affairs of 2019 things. Who was the chief guest? So like that, you have to know about 2023. Do the last 6 month current affairs. And we have already finished 1 batch with a crash course series of this UPPSC. You can still crack UPPSC. Trust me, you can still crack UPPSC if you haven't still started yet, or if you're confused on how to pursue with the UPPSC, because syllabus is too much. How to finish everything. Don't leave anything. Finish 1 to 2 subjects per day. If you want to study on your own, take the pulse, do the synopsis, and meanwhile, all the days, take out at least 1 to 2 hours of time for general studies section, because 30 questions are coming from general studies. So make sure that you don't leave the general studies section. Do the current affairs, do the GK part, and in the free material section of the app, we have already given the general studies material that can be downloaded, and you can read it anytime you want. But make sure take out 1 to 2 hours of your time so that you can do the general studies every day. And along with that, rest of the day, make sure to finish 1 to 2 subjects per day. So I have made a revision course, because students get confused at the last moment how to revise faster, how to finish 1 to 2 subjects in a day. So you can also join the crash course, that is the sprint course. In the sprint course, you will get access for 1 month of video lectures and notes that you can read in the app itself. So these 2 things you will get in the crash course, and you can finish 1 to 2 subjects in a day. So what do you do? 9 a.m. to 10 a.m. you make out 1 hour of time. Be specific, make a schedule. 1 hour of time for general studies. Throughout the day, watch the crash course video lectures, finish 1 to 1.5 subjects, and then in the evening, revise the points that you have finished the subject. Along with that, revise the general studies also, and do current affairs in the last hour of your day. So this is how you divide or you schedule your day and do your best in your exam. If you want to do self-study, do the synopsis of the dental pulse because we don't have much time left. We need to finish 1 to 1.5 subjects in a day. This is the time that we have got now. So we have to keep it pushing. Remember that you have to have faith in yourself, believe in yourself, and you can do it. You still can do it. Trust me, you can excel this exam. You can become a class 1 officer and you can have that position. If you study for last 15 days, if you work hard only for 15 more days, you can really do it. Just finish one subject, at least one subject, more than one subject, I must say, 1.5 subjects. Try to finish 1.5 subjects. And if you're not able to do that, join our crash course. This is equivalent to a pizza party. The cost is so minimal. So you can join the crash course and get all the benefits. I have hard work for 3 years to create this course and it is just at the cost of pizza party. So you can join the course, read all the subjects. Now remember, don't do pizza party till your exams. So you have to be very disciplined for these 15 days which are left for you, and don't waste any more time. Every single minute you can jump a rank. So remember, every single minute that you waste. Keep on studying, guys. Keep on studying. Don't waste any time. Make a schedule and stick by it. 1 hour of general studies in the morning, 9 to 10 a.m. Rest of the day, watch crash course video lectures. Finish 1.5 subject. Make a target of finishing 1.5 subjects. The points that you are not remembering, not recalling, these points you can either write it down or read it from the notes section of the crash course only. But within the app, you will get the access. So open the notes and you can read the notes and revise the points that you're forgetting. And in the evening, again, do 1 hour of the journal studies. Revise the journal studies that you have either studied in the morning or the previous day. And this is how you can actually achieve this dream. You can be a class 1 officer if you just study for 15 more days, just 15 days, remember, and you can excel the exam. You can hold the position that you ever wanted. You will also get access to the part 2 of this UPPSC 2019 paper discussion, and you will get it in the app. So download the DP Academy app if you haven't downloaded it yet, and we will also we will release the part 2 of this UPPSC 2019 paper discussion. And remember to stay motivated. Remember to keep your goal always. Keep watching yourself sitting at the chair where you always wanted to be, and keep studying, guys. All the best for your exam.